Hello, everyone, and welcome to our webinar, The Mission Health System Journey with Prophecy. If you're here to learn how Mission reduced turnover by 81%, you're in the right place. My name is Tom DeSantis from Advanced Practice Strategies, and before we begin, I want to let you know you're all set to mute. But if you have any questions at any time, type them in either in the chat box or the question box, and I can collect them for the Q&A at the end. So I looked at the RSVP list and observed we have a range of profiles in the audience today, including those of you who we met at a recent conference, our Gnosis clients who want to learn about prophecy, our prophecy clients who want to learn how they can maximize the tool, and then, of course, nurse leaders who are being introduced to prophecy for the first time. With this in mind, I tried to think of the questions you as a group would have based on today's topic, then created a 30-minute agenda to address them, including how can we better hire and retain nursing talent? So I think that's going to be our main objective for today. What is prophecy? How does it work? Keep in mind, this will not be a product demo, but rather a solution overview. How does Mission use prophecy? Our guests will explain their process. What impact does it have? We definitely will highlight client outcomes. And how is it different? We'll explain our holistic approach to assessments, and you'll understand the benefits to a client. At this time, I want to introduce our two presenters for today. My colleague, Leslie Jeffries, is a Senior Vice President of Clinical Operations in the Prophecy Division of APS. Leslie's a registered nurse with experience in ICU, step-down, med-surg, rehab, and as a Director of Nursing Services. Since 2008, she has managed the development of every clinical assessment added to the Prophecy Library. Throughout her tenure, she has worked with well over 400 subject matter experts in validity studies producing nursing and allied health exams, as well as educational modules to support core curriculum requirements of all professionals that work at the bedside. Thanks for being here, Leslie. Also joining us is our special guest, Lori Halula from Mission Health. Lori has 30-plus years in human resources, all focused in the healthcare industry. She was an HR generalist for many years before moving to HR leadership, first as an HR manager, recruitment and retention, and then to Director of Talent Acquisition for both non-provider and provider recruitment. Lori received her SPHR in 2000 and maintains membership in both the national and local chapter of SHRM, as well as being a member of ASHRA and the North Carolina Association of Healthcare Recruiters. In March 2016, Mission Health created a People Operations Division of HR, and Lori moved to her current role as Director of People Operations for Mission Health. Welcome, Lori. To get us started, I wanted to provide a brief overview of APS. We are the Healthcare Technology Practice Strategies based in Boston. Pardon the accent, I apologize in advance, there will be no subtitles. We work with health systems to build the best patient care teams. We do this through two solutions: Prophecy, our validated assessment tool, and Gnosis, our education and risk management tool, focused on the highest risk areas in obstetrics and emergency medicine. Today, we're here to talk about prophecy, and one of the core reasons why prophecy was developed by its founder, Ron Gonzalez, to reduce nurse turnover. This slide is all about the why. Depending on the source, it's reported that national nurse turnover is around 14%, and depending on how your system calculates it, the cost of one nurse leaving can be between $10,000 for direct costs or up to $88,000 for more indirect costs. Think about how many nurses in your system leave and do the math. Even with the most conservative projections, you're well into six figures, if not millions. Fortunately, this can be and is being avoided. Right now, I wanted to do a quick poll on turnover rates on our audience. Look at your screen, and I'm going to launch a poll asking the question, do you know the nurse turnover rate at your system or facility? So you can see here, the majority are in the 11 to 20% range. People, higher in the 21 to 30%, and still some in the more than 30%. So clearly, it looks like our content today is going to have significant meaning for most, if not all of you. All right, let's continue. Our clients using prophecy and the insights from those assessments to get to the root of the issue. Data for hiring decisions, data for personalized onboarding, and data for education and professional development opportunities, all of which arguably contribute to increasing your retention of your nurses. To tell us more about the solution, at this time I'd like to ask Leslie to join us, since she truly lives and breathes prophecy on a daily basis. Leslie?
Thank you, Tom. It's a pleasure to be here today, and I would like to personally welcome each one of you to the webinar today, and our goal is really to provide you with an overview of prophecy, as Tom mentioned, and also explain how the holistic assessment process really helps contribute to a seamless onboarding experience for your new hires, as well as improving efficiency in human resource efforts, and really just experience greater positive outcomes in patient care provided at the bedside by using a scientifically based selection process. So to begin, I'd just like to review some of the basic information demonstrated here on this slide about prophecy. So nearly 1/3 of all nurses in the United States have been assessed using at least one of the assessments in the prophecy library. Some of our clients include many systems and popular healthcare staffing companies that span across 41 states. And to date, there have been over 5 million total assessments completed through the Prophecy platform. Prophecy offers assessments for over 40 different clinical specialties, with obviously the most popular being med-surg, ICU, emergency department, and labor and delivery. But we also offer specialized assessments for those independent service areas such as endoscopy, GI lab, the cath lab, and trauma ICU, just to name a few. Also very proud to offer assessments that assist hospitals with succession planning in their incumbent work. So we have exams that test competencies in relation to responsibilities as a charge nurse, clinical nurse manager, and even a nurse preceptor. So another important thing to know about prophecy is that it was designed for nurses by nurses. So it truly is based on firsthand knowledge of what it takes to be an effective nurse. And when a prophecy originally started, we wanted to make sure that this approach also met rigorous requirements of the Department of Labor's Federal Uniform Guidelines on Employee Selection Procedures. So each assessment in the library is validated by external subject matter experts through either content or criterion validity to ensure compliance with those human resource requirements. Prophecy's holistic approach to assessment includes these three areas or three competencies that are critical to successful job performance. You can see on this slide that they include clinical knowledge, situational or communication skills, and finally a behavioral assessment that provides information about an applicant's personality characteristics such as temperament, disposition, attitude, and employer engagement, which we all know is critical to reducing turnover in the nursing workforce. In our experience in working with hospitals, we find that many hospitals currently evaluate only one aspect of job performance. So for example, a newly hired ICU nurse may have completed a behavioral assessment pre-hire. However, there's no actual assessment of actual job knowledge in areas that are important to the ICU, such as cardiovascular care, post-operative care, dysrhythmia interpretation, or their ability to accurately calculate and administer medications. Most of the time, some of these competencies are actually assessed after the person is hired, and sometimes they're assessed during the unit orientation. So prophecy makes it so easy to look at all aspects of nursing job performance that affect patient care. And as we all know, a clinically competent nurse is a must, and it's critical. However, it's typically the nurse that displays empathy and compassion and really has excellent communication skills that create a positive experience for the patient and their family. The power of prophecy is supported by years of research, including a sample of over 800 nurses. And I really don't want to get too technical on our webinar today, but the results that we found from our original study were truly amazing. The results demonstrated that the prophecy assessments are able to scientifically predict how successful a nurse will be on the job based upon his or her test scores on each assessment. Their performance on the clinical, situational, and behavioral are combined to provide one predictive score. And one of the most positive benefits is that it really takes the guesswork out of determining which applicant is best suited for any job opening. In fact, we've even had one client explain a situation to us in which they were required to terminate an employee due to behavioral issues shortly after their orientation ended. And after the termination took place, they actually went back, reviewed the behavioral results, and the very issues that contributed to the termination were clearly articulated as red flags in the assessment results. So our next slides will demonstrate how the results are displayed to you and how they can assist in customizing the orientation plan for your new hire. The prophecy clinical assessments provide you with an in-depth look at the applicant's job knowledge in the most critical knowledge domains. A personalized results page will display their performance in a variety of these domains linked to the specialty. So in this particular example, you can see this is a dysrhythmia assessment, and it's clearly articulated in the score breakdown that this particular nurse needs some additional education on heart blocks and interpreting junctional rhythms. Another example would be the emergency department assessment that includes domains such as emergency pharmacology, infection control, toxicology, cardiology, and endocrine, just to name a few of those. And these test items also assess the nurse's ability to apply critical thinking by using scenario-based content. So they are presented in a test item with a complex case, including information about how a patient's vital signs and other assessment data change over a period of time. And ultimately, they're required to determine the best intervention based upon the patient information, or they may be asked to choose one intervention should come next as it relates to the care plan for the patient. So for nurse educators and preceptors, these results pages are invaluable because the items that were missed on the assessment are provided in this report. It allows them to discuss these areas in which the nurse may need additional support and education, as well as linking these areas to additional educational resources in the learning management system to ensure not only that the nurse receives the information, but that it's also reinforced and validated ongoing through their orientation. The situational assessment identifies how well a nurse will respond in communication with peers, patients, families, and physicians when they are confronted with a very difficult situation. It's unique because it's a video-based test where the nurse watches a video simulation of a situation and later must choose the most effective response as well as the least effective response. So for example, this is one of my personal favorites. One of the vignettes portrays a patient who is involved in a motor vehicle accident, is in a C-collar, and is on spinal precautions with log roll repositioning. So the patient is, in the video, the patient's getting out of bed, they're twisting and turning and trying to sit up in the bed, which is obviously contraindicated in someone on spinal precautions. So the nurse is trying her best to get the patient to lie back down in the bed, and the physician enters the room. The video pans to the physician's face, and you can see that the physician is visibly upset and begins to tell the nurse that she is completely incompetent. So the video abruptly ends after the physician's statement, and the nurse must choose the most effective response and the least effective response. So after all 21 vignettes in the situational assessment are completed, the results are displayed in a similar fashion as the clinical results page. However, this time they're in a banding fashion, meaning that the nurse falls into one band, starting with A all the way through the fail band. And each band represents a percentage of how likely the nurse will perform in exceeding job performance expectations. It has the same type of breakdown of different knowledge domains, demonstrating areas of growth opportunity. So for example, you may have an applicant that does really well in conflict resolution and collaboration, but may need additional support and assistance in developing rapport with patients, families, and peers. And the last piece of the holistic approach includes the behavioral assessment. This assessment provides detailed information about an applicant's personality attributes, such as their preference in working autonomously or more in a team-centered environment. Other characteristics, such as conscientiousness, are also assessed, telling us whether the applicant is more carefree and flexible, or are they more detail-oriented, and do they favor structure? As we all know, nursing specialties vary in how care is provided and how the environment is structured. So for example, we all know the emergency department is very fast-paced. Everyone must work as a team during difficult situations in order to have positive outcomes. So the ICU nurse position allows typically the nurse some greater flexibility, autonomy, and the ability to work independently. So the behavioral assessment will provide you with a job fit score for the applicant as it relates to each specialty. And you're able to quickly determine whether someone that has applied for an ICU position is behaviorally matched for the qualities found in successful ICU nurses. Having been a nurse manager myself, one of my very favorite things about the behavioral assessment is that the results provide you with very specific interview questions into areas that might have been raised as a concern, that allow you to further probe and explore the applicant's personality as it relates to that particular characteristic. So as a manager, I know that I've made many hiring decisions based upon just internal gut feeling. I felt like this was going to be a good applicant and a good person for the unit, and unfortunately, it didn't always turn out that way. So I feel like if these questions, if I had had them available as a manager, it may have prevented bad hires and ultimately made my job easier. So that brings us to the next slide, which when an applicant completes these assessments, their scores are combined into one predictive score called the Prophecy 1 score. And in this image, the top row displays a letter, gray, which is A through E, representing the band in which the applicant resides, as well as a numerical score representing the confidence level that the nurse will meet in exceeding job performance expectations. And these Prophecy 1 scores are available for all clinical specialties. You can see they're the most common 13 nurse specialties that we have, but it's also available for other nursing specialties as well. So as we move on, we're excited to show you several analytics reports that are currently in development in our company. This one in particular displays the results of a large sample, it looks to be 98 in this case, from a particular med. At the administrator level, you're able to quickly identify the pass-fail cutoff score for this exam. So for this med-surg exam, you can see that the Angoff score, the red dotted line, represents the 73% pass-fail cutoff score required to pass the assessment. So each blue dot in the graph represents the score of a certain test taker. So it's a compelling visual that allows you to visually quickly determine who scored above or below the recommended threshold, so you can identify top performers and those that need additional education. Filters on the right also allow you to query the database based upon your individual selections. So you can look at overall organizational results, or you can dive deeper into a departmental review. So I think for educators, this will be extremely powerful. So for example, if you're administering the dysrhythmia assessment to all of your critical care areas, you can quickly identify how well did we do it as an organization, and then you can query the database based upon the individual department that you select. The situational analytics report provides a different perspective of the applicant's overall competency as it relates to, this is a behavioral analytics report. It's also in development, and it will allow you to search a pool of applicants to see where they rank as it relates to the best fit according to the specialty. So at a quick glance, you can see that the test taker name is displayed on the left. Their best fit that is related to their behavioral assessment results will be displayed in the next column, as well as all the other specialty profiles that exist in the database. So the next slide talks about the situational analytics. And this really gives you results related to situational competence or their effectiveness for their communication skills, as well as clinical job knowledge competency. So in this example, you note the strengths that each nurse possesses as it relates to customer service, displaying honesty and integrity. You can see developing rapport with patients, and particular job knowledge in domains such as critical thinking, the pulmonary and cardiovascular system, and the GI-GU system, just to name a few. So it's obviously important to us to create and provide robust, validated assessments in these areas of competency, but we also know that they must add value in one form or another to our clients who are actually using them. There are numerous ways that the prophecy assessments can add value to your organization, but there are two in particular that are worth mentioning here because our clients have actually measured their own return on investment after implementation of prophecy. Two different systems measured separate metrics, one turnover and the other the length of time spent in orientation. One hospital found a 53% reduction in nursing turnover after a 1-year period of time in implementation of prophecy. And the other was able to reduce the amount of time new nurses spend in orientation by 33%. And this was truly due to customizing their education and onboarding activities that were as a result of using the clinical results assessment pages. And these results produced a positive ROI for both entities. So I think at this time, we'd like for you to hear directly from an actual user of the prophecy assessment solution and how their healthcare system was able to positively reduce their nursing turnover and how they continue to refine their process by using prophecy in a meaningful way. And it was a pleasure working with Lori this past weekend at the ASHRA conference in Texas. So without further ado, Lori, I will pass it over to you.
Thank you very much, Leslie, and good afternoon to everybody that's on the call. I enjoyed meeting several of you at the ASHRA conference in Dallas, and want to say a special thank you to those of you who stopped by to meet Ann and I during the poster presentations. When Mission started looking at the tools we were selecting for quality of hires back in 2013, we looked at a number of products and considered some of the following criteria. First and foremost, we wanted something that was evidence-based, so that it was statistically valid and reliable tool. We wanted that holistic approach that we've heard Leslie talk much about. We had used different types of tools prior to that time, hard skills testing tools, or just simply behavioral tools that didn't paint the complete picture. And then we also were looking for something that could be used pre-hire as a point of consideration for making hiring decisions, and then post-hire to help nursing utilize the tool in order to look at skills gaps and assist new RNs that were orienting to our organization, or maybe not even just necessarily orienting to our organization, but transferring from one department to another. So we did evaluate a number of options and ultimately made the decision to go with Prophecy, and we've been very pleased with our relationship with them since that time. Some of the initial work that we did was learning about the tool, learning the ways in which it could be used, and then we had some internal discussions. How were we going to roll out the product? How were we going to establish our thresholds? So that, Prophecy gave lots of recommendations of best practice, but ultimately it was up to Mission to decide how we wanted to utilize the tool. And so it was a partnership of, if we're thinking about using it in one fashion, Prophecy might have given us some additional information. Yes, that's great to think about, but have you thought about this? So we were going in sort of not having that full amount of knowledge, and they were able to supplement areas that we had questions about. So we went through the implementation process. We decided sort of what our thresholds would be as far as scores, and then Prophecy did provide on-site training. We did decide to launch it initially as a pilot. Mission Health is a large system in Western North Carolina, and we wanted to make sure that we had the buy-in that we needed from the nursing leaders and from HR and administration. So we started with the Med-Surg pilot initially, and that was the focus of the training that we did in 2013. Although one of the other things that we did was used it for our nursing cohort that year, and it was incredibly helpful in placement of new grads in the nursing turnover. Some of the ways that we did get the buy-in was to show some of the data that Prophecy had shared with us about the ability to impact turnover, and then through our time with them, we've been able to experience those reductions in turnover ourselves. Retention is a strategic priority for the organization. It continues to be one today, and we wanted to get away from that gut feeling and have additional data points to consider when making decisions. So one of the things that we did was we actually looked at the turnover rate for non-new graduate bedside nurses, and in this focused period of time here, you can see that we've been measuring 90-day turnover, 1 year, and 2 year. And as most of you, I don't have to tell anybody on the call, the cost of turnover, I think Tom mentioned it briefly in the beginning of the call, but at ASHRA, we heard, and many of us use the 1.5 times an annual salary as one measure for cost of turnover. So what this slide basically is showing you is what our turnover rate was for the number of individuals hired using Prophecy versus those without Prophecy, and you can see that the total hires, there was much less turnover with those where we had used Prophecy. One of the things that we looked at is really making sure that we were matching. One of the items that we liked so much about Prophecy is looking at that best fit from the beginning, rather than just often we have nurses who apply for multiple departments. They have skill sets in a variety of areas, but we wanted to try to place them where they would be most successful. And we really felt like the retention metrics that you see on this slide spoke to the value in using Prophecy as a tool during our pre-hire process. And this is referencing terminations. These are involuntary terminations that we made, and you can see that the number of those terms using Prophecy was far less than those that were screened without Prophecy. A lot of nurses possess the clinical skills that were needed from a knowledge base, but that situational piece showed that they could apply that knowledge, and then the behavioral piece is where we find most of our corrective actions fall, is managing the behaviors of those that we've hired. On the attrition rate trends, basically we were going through a DMAIC process at the time, and we were looking at our 90-day attrition rates. And so for the period of time measured here, we were able to reduce our 90-day attrition, which has been as high as 5% in this snapshot, and down to 2.44. And that was comparing September of 2013 turnover in the first 90 days to September of 2014. And so we had launched Prophecy in 2013, and a year later we were able to reduce that 90-day turnover in that period of time. This is data that is for FY16, and obviously we can't avoid voluntary turnover. Economy's improving. There's other variables that cause people to leave. But what we find significant is if we're hiring at least the right people to begin with, then we have a better chance of retaining them and minimize the work that needs to be done by our employee relations team and others with regards to involuntary turnover. So we do believe that the tool of Prophecy, both pre and post-hire, has significantly impacted and reduced our involuntary terminations within nursing. Some of the other considerations and expansions of this is we did initially start out using Prophecy for all of our internal transfers, and we are not currently requiring that based on feedback that we received from our staff who felt like they'd been here for a long period of time, and why would I need to go through this? You know my history, I've been here for a while. So that's a decision that each organization has to make. I did find value in using it for internal transfers, but organizationally we found it better to not require that, so it's optional to use. On the behavioral piece, we actually have expanded our use of Prophecy in non-clinical areas such as security. The behavioral piece has a hostility factor that's been very helpful with security. Our lab is using it, our pharmacy is using it for pharmacy techs. So while this was a nursing-focused tool, it's flexible enough to be used in other areas. And that's one of the other items that we really appreciate about the product. So we continue to tweak how we're using it to make sure that we hire the best quality nurses. And we're working and partnering with our nursing education department. What's great about the education post-hire is it can link to things like lip and coding. It can give you education modules to assist with those skills gaps. So we feel that overall it has had an impact on our quality of hire, and then our time to hire, we can recognize more quickly individuals that we need to make sure that we onboard here at Mission.
Lori, thank you. That was perfect. That's a great story, and if you've seen one of our introductory presentations, we'd love to celebrate, your success and continued success. So I thank you for sharing that with everybody today. I'm going to actually go to our questions. If you give me half a second here. So Leslie, this might be for you. You mentioned ROI. Has anyone been able to apply to monetize some of the savings that they're seeing by using Prophecy?
Oh, that's a great question, Tom. I think early in the presentation where we mentioned the two metrics that our clients had looked at, one was turnover and one was reduction in orientation time, that particular client put some metrics to the time frame that was saved in orientation, both indirect and direct costs, and their final onboard savings, they estimated at around $9,000, a little over $9,000 per nurse. So, that's quite a significant savings when you're talking about hiring, 5, 10, maybe 20 new nurses, new graduates every year. It's a great question.
I think Lori may have answered this, but I'll ask it again just for clarity. Are these assessments just for RNs?
No, I think it's based on, it was launched as an RN or a nursing tool, but we use it for our CNAs. We have found it incredibly helpful for CNAs since it's a higher turnover population, and there is an assessment for those. We also have a post-acute arm of mission, and it sometimes breaks out some of the assessments as to whether it's a hospice-related position or home health or an acute care setting. And then we're using it for security officers, phlebotomists, pharmacy techs. The other thing, if I may, Tom, just add one other quick point that I like is within the platform, if you do a behavioral assessment and somebody applies for, say, a CNA, and then they turn around and they apply for a pharmacy tech position or a security officer, you can change the template on the fly, and it rescores based on the template for that job. So that's nice to have as well as a feature.
What are some actions taken to expedite the hiring process?
I'll start. This is Lori. One of the things that we've done is we've been able to integrate Prophecy with our applicant tracking system, and so there is an easier way to launch Prophecy to the applicant so that they can take it. It also is scored often before the manager actually interviews the candidate, and if there's low scoring areas, then the manager can go right ahead and ask those questions. It kind of teaches them the areas that they need to probe during the interview rather than having follow-up questions or second and third interviews to follow up on those low scoring areas. So that's one way in which it has assisted us with faster hiring.
Great, thank you. Another question, this is somewhat specific. If you have a new grad hired into the ICU, do you give the ICU exam initially or the med-surg exam?
What we have, and Leslie, Prophecy may have a different response, but what Mission chose to do is to give all new grads the med-surg exam, just knowing where they are coming from and that they don't have, necessarily may not have had their 180 hours of clinical in a focused area of an ICU. So we give them all the med-surg, but there was an earlier slide that shows the overall, based on their Prophecy 1 scores, we look at those, and then we look at the behavioral scores that says, this person's going to be a better match to the ED versus ICU versus med-surg. So we might have a new grad who really wants to be in the ED, but they're only a 29% match. But they might be a 75% match to med-surg or the ED. So we used it in that fashion.
Yeah, I think also, Tom, we recommend to our clients for new graduates, even if they're going into a specialty area like the ED or the ICU, that they are given the med-surg assessment because, the med-surg assessment encompasses many of the competencies that are on the NCLEX licensure examination. So what many clients do is just what Lori is suggesting, given the med-surg exam. And then about halfway through orientation, many clients will then administer this specific assessment to see where that particular nurse is on a competency scale. And then they can even repeat the assessment at the end of orientation to see how effective the education was. So we definitely recommend the med-surg for new graduates and then follow up using the specialty exams.
Thank you both. So in conclusion, I actually want to thank Leslie and Lori for joining us today and helping walk through not only what Prophecy is, but the mission journey, which I'm hoping a lot of you on the call will want to follow.